like be familiar with the code books, the ICD, CPT, the HCPC level 2. If you feel that you are stuck on any question, move on to the next question. And then when you have finished all the easy ones, go back to the ones that you have left. So be sure to practice with your CPT book a lot.
Welcome all. Thanks for watching this talk series. Today we would be covering the topic of what is certified professional coder and why is it important for being a medical coder. Now, we have with us Dr. Ashiwini Ghate. Welcome, Dr. Ashiwini Ghate. We would like yourself to just give some background of yours to the audience, and then we will start with the Q&A.
Thank you. Thank you for having me on the show. I am Dr. Ashiwini Ghate. I am a homeopathic doctor as well as a certified medical coder. And I have been in this field since almost 8 years. I train candidates to become certified, as well as I work as a consultant and freelancer with different medical coding or US healthcare company. So that's a little bit about me.
Thanks, Dr. Ashiwini. So I think the first question, of course, related to the topic would be what exactly this certified professional coder exam means, or in a short form, what CPC exam means.
So CPC exam, as you correctly said, it's an abbreviation of certified professional coder. It's one of the certificates that AAPC offers. There are many other certificating exams, and CPC is one of them. So it's a proficiency test to test medical coders' knowledge. The exam comprises of 100 questions covering almost 17 different areas of assessment. So there are questions from ICD coding that test the knowledge of diagnosis coding, CPT coding for procedural coding. Besides these two code sets, there are HCPC level 2 questions. Then there are questions from anatomy, medical terminology, as well as compliance and regulatory. Then there are questions from various other specialties also, like radiology coding, pathology, E&M coding, etc. Besides these, AAPC has also introduced a new section with 10 cases. So that means there are 10 case scenarios given, and coders are supposed to assign medical codes using their code books. To complete this exam, they are given 4 hours, and the passing percentage is 70%. So, you can see now that 100 questions and 4 hours. That means it's literally a race against time. So the more proficiently you code, there are better chances of you becoming successful. Now, another important thing I would like to mention here is AAPC offers one extra attempt in case you are not able to clear this exam in the first attempt. They will not charge you any fee for the second attempt, so it's a free attempt. So that's a little bit about CPC exam.
Okay. And after 2 attempts, there is no other attempts possible?
No. You can. They can go for exam. It's just that you will have to pay the fees again. The second attempt, second attempt is free attempt. That's what I was trying to say.
So can you talk a little bit about a breakdown of the CPC exam? I'm not sure if you answered in the previous question, but is there any details on what is the breakdown of the CPC exam?
Yeah, surely I can give you the breakdown. So as I was saying, 100 questions, and from the following areas, basically surgery coding. They cover surgery coding. So there are small case scenarios, and coders assign codes using their ICD, CPT, and HCPC level 2 manuals. And it actually covers coding from various body systems. So like a respiratory system, cardiovascular system, then the male-female reproductive systems. So besides that, there are ICD 10 questions, HCPC level 2 questions, then the specialties that I mentioned before, the radiology, pathology, anesthesia. There are questions from anatomy, medical terminology, then compliance and regulatory, and last but not least, the 10 case scenarios. So there are actually case scenarios given with the diagnosis, pre-procedural diagnosis, post-procedural diagnosis, then the actual procedure itself, and then they describe like how you will read actual charts. That's what, so it's a glimpse into real live working. Coders have to now assign codes using those your code manuals. So that's roughly the breakdown of exam.
Oh, okay, perfect. So I think we covered what it is. We also covered what the breakdown is. But I think I've heard a lot of times saying apprentice status. What exactly is this apprentice status?
So unless you have 2 years of experience, medical coding experience, the like AAPC will assign you CPCA even if you pass exam. In order to drop the A, you are supposed to give evidences showing that you have 2 years of experience. So typically a letter from your employer that you have 2 years of medical coding experience. If you send those letters, submit those letters on AAPC website, and then they will remove the A, apprentice status.
Okay. And this particular status is provided by which government or which body?
AAPC, as I was saying. So previously it was known as American Academy of Professional Coders. It's an American kind of a body, and then they're based in Utah, state of Utah. So it's by AAPC.
Okay, and I mean, and there is no Indian body or any other country's body which provides this status.
So as of now, and in my knowledge, I don't know any other, like besides American body. I don't know any other body. I think there might be something happening in the Indian system also, the education system, to incorporate the medical coding training. It is being done as a professional course, but I am not aware at least of any such body in India.
And how many countries are currently using this medical coding in the industries?
Oh, how many? That's a difficult question, because a lot of countries do use, but the one that I'm talking about, the CPC certification in particular, this one is like valid in the United States, obviously, in India, and in UAE, in Canada. So
in other places also it's being used in the profession, or is it just people working for American industries?
No, there are. I mean, as long as there is health insurance, the medical code assigning, that's going to happen. It's just that there are slight differences from country to country.
So I think we covered quite a bit on the CPC exam. Do you have any tips for the candidates for preparing for the CPC exam?
Yeah, certainly. So my tip number 1 will be, like, be familiar with the code books, the ICD, CPT, the HCPC level 2, because you're allowed to carry those code manuals into the exam hall. It's an open book test, so you are supposed to find codes from those code books. So be familiar. The more you handle them, more you use them, more efficiently and easily you will be able to find your codes, and then you can do it in like timely manner. So that's my first tip. Second tip would be, CPC does place a lot of importance on the CPT code set in particular. So be sure to practice with your CPT book a lot. Then my tip number, like next tip will be, on an average you are allowed 2 minutes per question. So don't like dwell too much on any question. If you feel that you are stuck on any question, move on to the next question. And then when you have finished all the easy ones, go back to the ones that you have left. So don't leave any blank answers. In fact, that's my next tip. Don't leave any blank answers, because if you leave blank answers, like there are multiple choice, these are multiple choice questions. So you always have the 4 options. If you attempt it, there is 1 in 4 chance of getting it right. If you don't attempt, it's 0 in 4 chance. So
there's no negative marking, is it?
No, there is no negative marking. And of course, like, and don't panic, like, stay calm, stay focused, move on, be familiar with your book. So those are my tips for CPC, but this is not just for CPC. These tips are good for any certifying exam. So these are general tips.
So on a lighter note, can't people take a laptop and a PDF to do Control F and find on the book?
No, that's why you are You're not allowed the laptop. You're only allowed those the official
Physical books.
manuals. Yeah.
Okay.
That's why you are only physical books.
I think we are almost at the end of the talk show. The last thing probably we also asked in the medical coding talk series, but it's always interesting for the students to know, what career options they get after they go into it.
The career options, obviously you start work as a medical coder. First and foremost, you will be working in the US healthcare field. I'm talking about the job scenario in India. So you'll be working in US healthcare field, and there are a lot of billing coding companies. I think we covered this topic in the last video. So there is a lot of outsourcing happening for a lot of companies in India. So you can actually join those companies. They're always looking for certified coders, and being certified actually increases your chances of getting hired. And typically, the certified coders make like 20% more salaries than non-certified coders. That's the observation. So yeah, you can start as a medical coder. Then you can work up your ladder. So typically you'll be working for US healthcare.
Okay, perfect. Thanks very much, Ashwini, to coming back to the talk show and talking about this field. I hope this would be quite relevant for the students and they learn from this.
Thank you for
a lot.
having me again. Yes.
Thank you
and
very much.
hope to come back soon. Thanks.